In layman's terms, that sexual addiction is any sexual behavior that is repetitive and compulsive and driven, very engaged and in fantasy. And I think that the more you are engaged in that and the more you allow yourself to lose yourself in a fantasy, the more you could call it problematic, or it would be problematic because it's disrupting your reality, which is usually a job or a relationship or marriage or work, children, family, healthy sexuality with your partner or your spouse. I think it's very dangerous to get into situations where your impulses are running your life. In terms of recovery, I think it's important to assess as a clinician and someone working with someone the level of severity. And when I say that, that what is out there in terms of resources ranges from information that you can seek on the internet to read yourself, books that have been published about this. There's a range then of the sex addicts, the Sex and Love Addicts Anonymous, Sex Addiction Anonymous. There's the 12-step programs for people that want to pursue that situation where you're in a community of people that meet regularly and talk about this and feel supported. I think that if someone is extremely involved in dangerous, high-risk behavior where they're really having trouble controlling their impulses and their behavior, there's also recovery programs that you can attend. You can go anywhere from 30 to 90 days, much like you do a drug and alcohol rehab. There are resources that you can find on the internet. You can go to www.sexaddicthelp.com, which is a site that I participate in. I deal a lot in my practice with people that come to weekly treatment with me, where we explore the underlying causes. And so I think in my mind, the best case scenario would be someone that's willing to do in-depth private psychotherapy to really get at the underpinnings of this and understand the dynamics that are driving it. And then, if that person so desires, to seek a 12-step program. In terms of full recovery, I think people do. But I think that people, when you say full recovery, what I take that to mean is someone who stops the behavior altogether. But I think it's also important to realize that this aspect of someone is not something that can be eradicated, and that it's something that really has to be worked on and maintained. And mindfulness around this has to be cultivated in order to stay aware of when the impulses take over, because as humans, we have a very fluid life, and we go through periods that are difficult, which can lead to triggers, which can lead to repetitive behavior and lead you back down the cycle. I think sexual addiction and compulsivity is about non-choice. And I think recovery is about learning that there are choices.